Hi, everyone. How's your break? Good? Cool. Um, can folks in the webinar hear us and see us clearly? Just wanted to double check. If you guys can put a quick yes or no in the Q&A, that'd be great. Uh, right now, we have a wonderful opportunity to hear from some of our wonderful patients here at UCSF. And so I wanted to just give a quick introduction to our panel here. We have David Menti over here on the right, and next to him is Callie Carter, and then Mike Gunn and Roberta Scarcello. I'm saying these things wrong. Sorry. Um, I'm going to ask them to just kind of give a really brief introduction of themselves, where uh, a, a little background about their cancer journey, and then we're going to open it up to questions, and the chat can ask questions as well, but I'll welcome questions. If you have a chance to write them down, maybe some of our medical, you can raise your hand, and maybe some of our medical students can go around and grab them and take them up here to me. That'd be great. Thanks, y'all. And so you're on, Roberta.
No one wanted to go first. My name is Roberta Scarcello. I'm 78 years old. I don't look it. I went through my notes the other day, and the short version is 5 pages, but I'm not going to bore you. I started having problems in July of 2019. I had a implant put in my upper left jaw. Was giving me a lot of problems. Felt like I had a family of chipmunks living inside. My periodontist sent me to UCSF Dental Oncology Clinic. They saw me and immediately sent me to Dr. Odira, who did a 3-hour surgery, kind of scraping. Called me 5 days later and said, "We're all in shock. You have cancer." Like, oh, where? Within 5 weeks, I had met the team. My first two surgeries were um, in October 2019. Dr. El Sayed saw me in there for 6 hours. I have no teeth up here. Took out the teeth and the cancer, stayed in recovery that night, and the next morning they wheeled me into Dr. Knott, who put a flap. Does everyone know what a flap is? Okay, they take your piece of your thigh along with artery and vein. They stuffed it into my sinus, connected the artery and the vein, and every hour for 48 hours, they put a Doppler on to make sure that it was attached. December 26th, I started radiation. December 27th, I started complaining about a pain in my neck. Eventually, they upped the radiation to over 70 gray. And that May, they did a neck dissection and took 26 nodes. Two still had some cancer. So that's 4 surgeries. In the next year and a half, I had 5 more. I'm a bionic woman. I had to have my initial flap replaced because there was a hole. I could, after one surgery, my left eye would not close voluntarily. I have a platinum weight in my eyelid to help gravity close my eye. They had to rebuild a tear duct. I am one of the few that have osteoradionecrosis, dead bone in my jaw. I spent 6 weeks, 5 days a week in a hyperbaric chamber. I don't know if it helped. I don't know if it didn't, but I got to watch all of Breaking Bad. I started sweating over here. above my ear. Dr. Knott said, oh, somehow your salivary gland nerve and your sweat gland nerve crossed. So when I eat, I sweat. There's a solution, Botox. And my newest bionic woman game is in 2 weeks. I'm going for a procedure with Dr. Ma, who's going to inject filler, like when you get your lips filled, in the back of my throat to close the gap so that the food and drink will not go down to my throat, but will, stay in my mouth and then down my esophagus. And they say that it's going to help the nasalness in my speech. So let me give you 2 more topics, things that I found helpful. Get a notebook, a spiral small notebook, and take notes. Bring questions to the doctor in your notebook, and then any notes leave there. That's what I did. I use paper cups because I can't feel the glass. I'm paralyzed over here. I use a lot of paper napkins because I drool because I can't close my lips. I use a water flosser. I had to get a squeeze bottle. See, I can't spit. I can't use a straw. I can't suck. And I can't kiss. Sorry, Mike. So I got one of these squeeze bottles with a straw so the water goes out. You just got to keep a positive attitude. My biggest challenges now is trismus. I can only open my mouth on a good day to here. Normally now it's to here. So I have to cut everything. I can eat everything except an egg roll. I can't get the egg roll in my mouth. No, the egg rolls can't. I can get a hot dog. I eat it in wedges. I drool a lot, and my enunciation has gotten bad, so I try to speak slowly. I'm 5.5 years out, and I will tell you, as I went through this process, I kept asking Dr. El Sayed, when am I going into remission? And he said 5 years after the last cancer surgery, which was in May of 2020. So in May, I say to it's 5 years. I said, am I in remission? He said, oh, we don't use that term anymore. And I want to invite any of the medical students who want to look at my scars or anything, you're welcome to catch me at the rate.
Okay, that's going to be fascinating to follow up. My name is Mike Gunn. I'm 67 years old. I'm just a youngster. Just a little background. While born in California, I grew up on Guam, very small island out in the middle of nowhere, hence the shorts. My wife is like, you're wearing shorts to your present? It's summer and I'm an island boy. I'm going to wear shorts. Anyway, so I was healthy my entire life. I had, except for breaking this arm twice in 1974, that were on me, I had no health issues, nothing. Mild anemia, but whatever. Back in, I guess, 2018, 2019, I just had a small little bump behind my ear. Hey, general practitioner, what is this? Yeah, we don't know. Maybe it's a gland that expanded, and when it contracted, it turned hard. We'll just keep an eye on it. Fair enough. Next year, it's the same. It's just sitting there, nothing. In this, is that me? No. Oh, it's all right. In summer of 2020, this thing took off and it started growing and growing and ulcerating, kind of like that picture of the ear that you saw like that. And I'm like, what's going on? go to get the, come down here to this wonderful 6-story building across the street, get the biopsies and everything, and it's cancer. And I am knocked off my ass because, again, I've been healthy all this time. Had head and neck surgery where lost part of the bottom of my ear, but they opened me up from here to here, took out cancer, all sorts of lymph nodes and everything. Like her, I have a nice, probably 12-inch scar where they took tissue out. In my term, they took tissue out of my leg and spackled it into the holes that they put up here. And was in the hospital for about 4 or 5 days. Then I did radiation and chemo all at the same time, which is a fascinating journey. What was also fascinating, Dr. Knott, he's this amazing surgeon. When they did the surgery, they pulled up some of the skin and tucked it in there. And maybe a month or so later, went in and rebuilt my ear. But also because of that, I have kind of like a half facelift. And so I only have to shave from here to here. I don't have any whiskers over here. And I never had much of a beard anyway. Through all of this, she took notes and everything. What I did, because of what I call chemo brain, trying to remember things, I've always been a numbers guy. Even though I was with the sheriff's department, so I was law enforcement, I like numbers. So I had a spreadsheet, everything from did I brush my teeth in the morning, after evening, whatever, all the different medications, I could check it off. I had a visual reminder. Yes, I did do this. Even the mundane things, we all brush, well, hopefully we all brush our teeth at least in the morning. I had to check it off to make sure I had it done. My main challenge was anger. I was angry. I was furious with the universe because this was not part of my plan in any way, shape, or form. I eat right. My head is in the right space. I do good. I have humanity, and it's nothing I can control. And I was angry, but it was talking to the therapist. I had Teddy to begin with. And talking about that. And also, I have to admit, screaming at the top of your lungs inside your car or crying in the shower are completely appropriate responses to it. But I got over the anger. And what helped me get through it is curiosity. Curiosity. What are we doing? Why do we do this? Something as simple as, why is there a dark bag over the chemo bag? You know, why? I wanted to be part of it, but also curiosity. When I went through radiation, I set up my phone and took a video of it just to see what it actually looks like. So I can maybe help other people going down the road, like with Immerman Angels and everything like that. Some of you are probably familiar. But again, ask questions. Be demanding. Because if you're not going to advocate for yourself, really no one else is. And we'll probably talk about that a bit more. Thank you.
I am Kelly Carter, and I live in Napa Valley, where my life is eating and drinking. And I'm sure it's all that wine that contributed to my adenoid cystic carcinoma, which is a type of cancer I was diagnosed with. It's a very rare cancer. It's only 4 in 1 million people a year who are affected by it. And I didn't have any symptoms. I went to a new primary care physician in February of 2022. And it was a concierge doctor. She's the best doctor in Napa. And she was very thorough in her exam. And she said, say, ah. I said, ah. She said, what's that? How long has that thing been on the roof of your mouth? And I said, I don't know what you're talking about. I said, I get my teeth cleaned every 3 months. I just saw my dentist last month. He didn't say anything. The hygienist has never said anything. So she said, I'm going to send you to an ENT. And So I left with all my marching orders, your mammogram, thyroid, everybody wants to check my thyroid, pap smear, all that, everything. Everybody called and ENT never called, but I didn't think anything about it because it just slipped my mind, which is so unlike me because I'm always on top of my health care. Not that I ever have any issues. Anyway, it took 6 months later and an ENT called from another hospital in Napa. So I went in to see her and she asked the same questions. Do you have any pain, any bleeding, is anything wrong? Like, nope, everything. I don't even know. I don't even know what looks like. Everything's normal to me. And so she said, we'll monitor it. And I said, okay. So I returned 3 months later. There were still no other symptoms. They did a CT and that came back. Everything was fine. She said, I'll see you in another 3 months. I said, okay. So now February 2023, so I'm a year past the time when my primary care physician noticed something. And she said, it looks the same. She said, Kelly, this can go on for 10 years. Do you want to do a biopsy? I said, sure. So she did a biopsy and the results came back that everything was okay. But it said, we're going to send the tissue to UCSF for further interpretation. So thank God that, because I didn't even know the hospital would ever do that. A lot of doctors might think that they're God and think that, okay, they've got the final word, everything looks good to them. So I'm so grateful to the hospital queen for sending the tissue to UCSF because a lot of people, because the cancer is so rare, they just didn't know what they were looking at. And so the ENT told me that I had cancer. She told me what type it is. And she told me I was going to see Dr. Ha, and she talked very highly about, she's like, I know him personally. He's a great doctor. He has some connection with Napa, his wife or something like that. So I go to see Dr. Ha. I bring him a bottle of wine because I'm going to bribe him and make sure I get the best care. So I took him a very nice bottle of wine. He said, why are you bringing me wine? I said, because I have a lot of wine, like 500 bottles or so. I said, I have a lot of wine and I'm sure that wine caused my cancer and I'm not drinking. And Dr. Ha's like, no, we don't know what causes this. I'm like, okay, give me my wine back. He didn't. No. But anyway, so I had surgery to remove part of my palate, jaw, and a molar. And he had recommended that I get an obturator instead of doing the flap surgery. So I have a hole in the back of my mouth that's about that big or so, kind of where the soft and hard palate meets. And cancer is a minor salivary gland. And so I wear an obturator, which is a dental appliance. I could pop it out and you can like hear how I talk without it, but it helps me to enunciate and it keeps food from having, nasal regurgitation, which basically is my food will come out of my nose and my mouth if I don't wear it. Well, I've learned how to eat without it. Dr. Yan was amazed through radiation. She's like, how do you eat? Because I couldn't wear the obturator, my mouth changed. Anyway, I might get the flap surgery at some point. The obturator works fine. Sigmund Freud wore an obturator. So did President Grover Cleveland. He wore one when in office, and few people know that. And so the obturator works fine. It has its, drawbacks, but some of it's easy. I don't know if I'll go through the invasive surgery. I'll be 63 in a few months. And so I don't know if I want to go through that surgery. We'll see. But I had 30 rounds of radiation with Dr. Yam, who I got to know when I lived in San Francisco and lived with a guy who was diagnosed with squamous cell carcinoma inside of his nose. He ended up having his entire nose removed. So that was all good education for me because I was a caregiver. I knew the radiation mask. I knew nothing surprised me at all. And so I was able to do everything very well. The guy who I was dating, he was down to the size of my finger because I had to like make all these shakes and try to fatten him up. So I didn't lose any weight. I knew exactly what to do with my treatment. And I asked Dr. Yam when I had my first consultation with her, and she used to laugh at me when I was the girlfriend because she'd come in the room. She's like, "You're still here. You're a new girlfriend. Anybody else would be gone, But those trips, and it's like I knew exactly what what to do. But I also got acupuncture, which I think really helped me. I started acupuncture the same day I started radiation. Dr. Yam helped me find an acupuncturist, Osher Center. They were booked until they weren't going to be able to get me in for acupuncture until right after I finished radiation. And I said, no, I had done my research. I was a journalist for years, so I do a lot of research. And I said, no, I have to do it at the same time. And so I didn't lose a sense of taste. I had a little bit of dry mouth, but not that much. And I didn't have any nausea. I stayed at the Cause House. I don't know if anybody knows about the Cause House, which is a terrific resource that UCSF provides for people going through cancer treatment and organ transplants and things like that. It's over by Parnassus. And it's a wonderful facility. They have 27 rooms. And so I stayed there and drove home to Napa on the weekends. And so I thought during radiation, I thought after a while I wouldn't be able to drive home, but I did. I drove home. I never had nausea, so I was fine throughout radiation. I had some mouth sores near the end, but I'd go home and people would see me and I'm walking to the vineyards and I'm at restaurants ordering food and I ate all through radiation. I had everything I wanted to eat. Sometimes I'd have to eat in private because I couldn't wear my obturator, but all the restaurants were great. So I'm like, I know you don't do takeout on the weekends, but I'm only home on the weekends. Can you, make something for me? And so I handled everything very well. I had trismus right after radiation, and Dr. Ha hopped on it immediately. I got my aura stretch and then was able to eat hamburgers and everything throughout radiation. But then after radiation, 2 months later, then I couldn't even open my mouth wide enough to get a grape inside. I love grapes. And not just in the wine, but because I like to snack on grapes. And so I worked diligently with Kara and I went from an aura stretch to Therabyte and then back to aura stretch. I got on the phone and I did a Zoom with a top guy at aura stretch. And then they sent me one that was like in beta mode or so. And so now I can open my mouth, 45 millimeters. And I don't stretch anymore. And so, but I had to work my butt off to be able to open my mouth again. And the only side effects, I did lose hearing for a while, but it got to a point where I was just getting fitted for my hearing aid. It was time for my appointment to get fitted. And my hearing came back. And they said, and so every so often it disappears or something, but it's like if you have hearing loss or something, don't give up. Sometimes as things come back, it's like you just don't know after radiation. My main thing is I have a lot of mucus and I have this whole left side of my face is impacted. I've got mucus that's not going anywhere. And so I don't know what I'm going to do to get rid of that. So I go to the sinus doctor at UCSF. He wants to do a balloon sinuplasty. I'm against it because it puts me at risk for a necrosis. And so anyway, I go back and forth. I'm going to go to Stanford and go to their sinus doctor. I had asked Dr. Ha, I said, can you write me a referral, please? I was like scared to ask my sinus doctor because it's kind of like asking your husband, can you have an affair? Can you go and cheat and go to Stanford? And so, but it's like, I know I need to get, I don't know if I need to get the mucus out. I don't know. I'll find out when I go and do that. But that's my journey. And the worst part is that I have possible lung mets. And so that's pretty common with ACC. It's very treatable, but it metastasizes to the lungs. And so I try not to think about it. I remember when I got my CT, I was here and then I was going to SFO, jumping on a plane, going to the Caribbean. I'm 7 months out of radiation. I'm going party in St. Bart's. So I'm meeting my girlfriends in St. Martin and we're going to St. Bart's. By the time I land, then I have my results And of course, I'm trying not to freak out because I'm not telling my girlfriends. I'm not going to spoil our vacation. And Dr. Haas sent me a message and he's like, Kelly, go, but if you look good, you feel good, you're in the Caribbean, focus on that. And so that's really what I focus on. So, and we'll deal with the lung mets next CT. I mean, they're growing. So it's probably about a year out before I have to do something with them. And so we'll see. That's my journey.
Um, I don't think I have as exciting a story as my predecessors, but I am the longest at 93. I was diagnosed. It was a journey to be diagnosed. In that, at 43 years old, I wasn't really a candidate for lung cancer. So the EMT and rounds of antibiotics because they thought it was an infection. And after that, no improvement, biopsy, and then we found out that it was cancer base of tongue. Back then, they didn't test for HPV, but being a non-smoker, non-heavy drinker, it's pretty likely that that was the root of my cancer. Now before surgery, that was interesting. I had a radical section with a flap rebuild before my dorsal epiphysis in my back. Recovery after that was just normal, not having any reference points. But I had no speech. So I had to learn how to be able to enunciate and talk. And thank God UCSF was here. I got with a speech therapist called Dress, who took me under her wing. We did normally bi-weekly sessions analyzing what speech was attainable and practice on articulation. And then we progressed through a palatal prosthesis to help me with enunciation and swallowing. And all of this, my goal, my driving force was to regain my unrestricted medical so I could go back to flying, one of my hobbies. And from there, life just continued. I was able to watch my daughters grow up. One of them get married. I have grandkids. So that's all been a gift that was given to me by the health services from UCSF. I guess I should say my original surgery was at UCSF with Dr. Skinner. So here I am today enjoying life, back to doing everything I used to do except water skiing and diving. But I'm back to flying, skiing, fishing, enjoying life.
You can keep the mic. Any questions that folks have? Yeah, one moment, Roberta. The question was was asked too. Yeah,
I
Yeah.
have maxillary sinus cancer, which went into my cheek. 2019, pre-COVID.
I had a squamous cell cancer that started here, went inside down the salivary glands and everything. And also, actually, I even lost some muscle tissue in my shoulder. I've lost range of motion and everything. And that the surgery was in January of 2021.
Adenoid cystic carcinoma, diagnosed in February 2023. Surgery April 16, 2023. Completed radiation August 3rd, 2023.
So it's been so long ago, I can't give you months or dates. Diagnosed in 93 with squamous cell carcinoma base of tongue, and at diagnosis, the tumor was at T3. The surgery was in 94.
We had some questions. Shout it out, and then I'll repeat it to the group. To David, yeah, to Dave.
That's my wife. Yes, I do love you.
The question was to ask David how he eats now with the things that has changed.
Well, not having a son, I never really appreciated all the things it did outside of being a visual cue to someone that I didn't like them very much. I'm unable to chew. So being unable to chew can be somewhat limiting. But I've developed a blending method where I blend my food. And thanks to the operator, I'm able to eat with a spoon, put the food in my mouth and move it in a bolus through my throat without having to pitch my head, which that's a real benefit. And I have a travel kit with a battery-powered blender, which didn't exist when I had my surgery. So that allows me to go out to dinner, order whatever it is I'm in the mood for, with some hot water, blend it to a soup consistency, and eat.
Thanks, David. Kelly's showing folks what it's like when she takes her
I know.
operator out.
It's like magic. And the reason that I have this, so I can take it here. Not, I don't want to put my saliva on.
I'll hold it for you. You're among friends.
That's okay. I like pop it out with that.
We'll
And
sanitize
the
later. It's all
reason
good.
I didn't do the flap surgery, and as you know, Dr. Hogg explained to me. So when I go in to see him, I can pop out the obturator so he can keep an eye on the area where the cancer was. And I still have that option to do the flap surgery later. And sometimes I went back before I was like, do I want it? But now I see a lot of people who are in my ACC support group and their flap surgery fails after it gets radiated because you're radiating that area. So then they have to go back and get it done again. So I'm glad that I have the obturator.
Kelly, can you demonstrate one more time when you take it out? Because I don't think the online people could hear the difference.
Really?
Yeah.
Okay, so this is how I sound without it, kind of like I'm underwater. And then even wearing the obturator, I can't do things like if I take a sip of water, I can't put my head down right afterwards. So I'm 6 feet tall, and when I'm at cocktail parties and I'm drinking wine, I need wine. Sometimes non-alcoholic or de-alcoholized or the real stuff. But I'm looking down at short people. I can't take a glass. I can't bend my head down. So the wine's gonna come down because it's not airtight on here. So I have to like always hold my head up.
Thanks, Kelly. Appreciate it.
Thank you.
Thanks, Brian.
I have some hand sanitizer in my purse. I can't look down.
Just think that we're doing show and tell. I'll show you my operator and you can hear the difference in my sleeping ability with and without. So, here is my speech without, and it's much more difficult to form the words without the operator. As opposed to Weinstein. It does help with saliva. And I too have to be careful about drinking and speaking. But being short, I'm always looking up. So I don't dribble.
Thanks, you guys.
I will say one of the most challenging things was when I had to go get an impression taken for the obturator because they didn't tell me. It wasn't until I was in the chair of the prosthodontist and he starts filing my teeth. And I start crying like a baby. I didn't cry throughout any of the diagnosis or anything. But fucking with my teeth, I'm like, no. I am like obsessed with my teeth. And I'm like, what are you doing? And he said, well, I have to file to be able to. I said, like, nobody told me that. And so, it took a while for them to calm me down. And then when it came time for the final obturator, because you get a temporary one, and then came time for the final one, they had to file more because the wires are thicker. And I would just sit in my car over at Parnassus and just cry, and scream. And then get back on the road and drive back to Napa to my little piece.
I couldn't get one because I can't open my mouth. But I have found I use salad forks, not regular forks, wherever I go. I use teaspoons, not tablespoons, and I always ask for an extra napkin and I put it in as a bib. So you learn to adapt.
One thing that Dennis had given us is maybe some talking points. What was a challenge? What was successful or whatever? For me, a couple of things is one is we have a peer support group that we meet once a month or whatever. And the amount of things that I have learned just by somebody having an offhand conversation. Like I'm being treated right now for some nodes in my lung. I thought that, oh my God, I'm different. I'm weird. This is happening to me. And she just at one of our monthly meetings just happened to say offhand, oh yeah, I got some stuff in my lungs. I got it. And evidently, and two or three other people said, oh yeah, we have these too. So as I like to say, we are not special snowflakes. You know, that ended in kindergarten when they told you sit down and be quiet and, you know, whatever. But also, I really didn't have any nausea either. But with the radiation, I had a very dry mouth. And with the chemo, I just lost the urge to eat. Nothing. And it was one day, it's like, I haven't eaten it. And it was like a Sunday evening. I haven't eaten anything all day and I don't care. And I hadn't followed the advice about gaining weight. And so I was in the high 130s and it was scary. I'm like, oh my God, I'm going to have to get a feeding tube and all this kind of stuff. I talked to my Jules. What's his?
Symptom management.
Yeah, symptom manager. And he's like, just go in and talk to Greta. And she's like, oh yeah, we'll just put you on Ensure and all this. And so I lived on Ensure and some other stuff for like 3 months because I just pounding it down. So again, I wasn't special. She didn't like stand up and go, oh my God, what's happening? And run out. We're not special. We're not. We all have these fears and insecurities and symptoms. But at the end of the day, these guys have seen it before. They really have. A challenge I continue to have is illness envy. And that doesn't make sense, maybe. I'll say, I was with the Sheriff's Department for 30 years, ran our peer support unit and everything. And I also volunteer at a retreat for first responders suffering from PTSD. And quite often, like we'll have 6 clients at a time. And I've never been a client, just a peer, but it's like, I just had, nobody shot at me. No one attacked me. I just had to do this or that. And I am not worthy of what I deserve. It's something I still fight with because, I mean, most people can't even tell I had cancer. Even when I was going to chemo, I'm like, hey, how you guys doing? Or at radiation, I'm just bounding in like some goofball. And I look around at people that are really struggling. And it's a constant battle that to tell myself that I am worthy. And regardless, and my response is a valid response. And I've said to many of the team, in fact, I've even sent the message to the team. So again, I grew up on Guam that is very heavily military. And at the naval base, there was a big sign outside that said, lest we forget, our primary mission is to support the fleet, right? Somewhere here at Mission Bay, there must be a sign for the staff that says, lest we forget, our primary mission is support the patient. Because from the top of the line, let's say Dr. Ha or Dr. Heaton, to the guy pushing you around the wheelchair, yes, we're part of a cancer conveyor belt. They're just going to keep coming through, but I was never felt to feel that way. And I don't know how they do that day after day after day. But regardless of what your journey is, you have to advocate for yourself, and we're all worthy.
I want to say that I consider myself extremely lucky. My mother died of breast cancer when she was 53. I didn't get cancer till I was 73. Look how lucky I am.
I'm going to kind of close us off with one more question for one or two of you to answer. Since we're live, go ahead. Here's the question. Yeah.
I
The-
par I
Mike,
parse
I'm
it.
going to repeat the question for the online folks as well. The question was for our wonderful panel to share their wisdom for someone who is at the beginning of their journey, and what may they have wanted to know before they started their journey.
For me, it sounds corny, but gratitude. That what has changed since his surgery and everything is astonishing. What Dr. Ma talked about this morning is astonishing. So gratitude, even when you're locked down on a table getting radiation, it's like, wow, we have come so far and we can do this. They're not just radiating you till your hair starts to smoke. You know, they know exactly what they're doing, when and where. Gratitude and curiosity.
Get a notebook, write down your questions, bring them to the doctor, put a date on the top. You can look things up online, but don't believe anything more than 2 years old.
And I say, record everything. And so I never took anybody to doctor's appointments with me. I was a journalist for 30 something years. I pull out my iPhone, ask the doctors, could I record? And Dr. Ha would laugh at me because I would say, well, how do you spell that? You know, he's using all these words. How do you spell that? How do you spell that? And he's like, what is she going to do? Go home. And I'd go home and I would seriously transcribe everything. Of course, they have apps that transcribe for you, but I'm old school journalist. And so hearing the words, hearing over and over again, it just helped me understand the process that I was going to go through. And and the other thing is to advocate for yourself all the time, or get one of your doctors. I did run into a thing one time when they made my temporary obturator. You get fitted for it before you have surgery. So, and then it's put in your mouth after surgery, but then it doesn't really fit. So it wasn't fitting just right. I was having issues. There's a lot of issues. The prosthodontist kept giving me different things. It's like it wasn't working. I was going to go over his head to the top prosthodontist, but my first cousin, who's a nurse, she said, no, doctors like to hear from other doctors. So I mentioned to Dr. Ha one conversation, I was having issues and he went and fought my battle for me. And suddenly they redid my temporary obturator. And so, but I was glad that I didn't have that. I didn't have to go over somebody's head. I just went to Dr. Ha. My medical team's so amazing.
Sense of humor and the positive attitude. Some of you may or may not remember the name Christopher Reeves, the actor who played Superman. In the blink of an eye, he went from Superman to a paraplegic. And anytime I would feel sorry for myself, I would think about him and how much better off I was. And I want to say kudos to UCSF for developing the support programs. They were, if not in existence in their infancy in 93 and 94, you talked about radiation to your hair catches on fire. Well, I did a protocol twice a day on my radiation. There was no nutritional support for me at that time. I lost 120 pounds. It was difficult to get water down, let alone nutrition. So we have come a long way, and I'm thankful for that.
I just want to give a very heartfelt thank you to our wonderful panel, David, Kelly, Mike, and Roberta. Thank you for sharing your journeys and your heart and your voices with us. And they're going to still be around. So we're going to enter into a period of lunch until 1:15. You're all welcome to hang around. There's a map in your folder if you want to go about to have lunch. We'll have volunteers stationed near the doors if you needed to get back in at some point. So I'm going to let you guys break off and please enjoy lunch. We'll be back at 1:15 for our first afternoon session. Thank you, everyone.